Bismillahirrahmanirrahim. The secretion of the hormone and its feedback control is discussed in this video. Negative feedback is a process in which the end product of the hormonal action suppresses further hormonal secretion, and its goal is to maintain physiological parameters within a homeostatic range. The trigger for feedback can be the hormone itself, the biological effect, or a downstream metabolite. So here you can see whenever endocrine gland secretes a hormone, there is increased plasma concentration of that hormone, and effect on the target organ is produced, and due to this effect a product or condition uh, due to hormone action is initiated, and this condition hormone concentration may impart a negative feedback, and this negative feedback can be due to any of the regulatory process at the level of gene transcription, gene translation, processing of the hormone, and release of the hormone, or receptor activity of the for this hormone. So the system stability prevent hormone overproduction, protect from hyperactivity or exhaustion of the target organs. Here in this table, the various examples for negative feedback loops are described. The hypothalamic pituitary thyroid axis, whenever there is low T3 or T4, thyrotropin releasing hormone is secreted is that stimulates the TSH secretion that causes the release of T3 and T4, and T3 T4 inhibit the TRH that is released from the hypothalamus, and TSH from the pituitary. Then there is another axis, that is hypothalamic pituitary adrenal axis. Here, due to stress, corticotropic releasing hormone is released, and this causes the release of adrenocorticotropic hormone. And this adrenocorticotropic hormone causes the release of cortisol, and the cortisol concentrations will inhibit the releasing hormone and adrenocorticotropic corticotropic hormone. Another example is blood glucose regulation, in which the high glucose concentration will result in insulin release. So this released insulin will lower the glucose, which suppresses further release of the insulin. Parathyroid regulation involves the low calcium concentration that causes the release of parathyroid hormone from the parathyroid gland, that uh, increases the calcium ion concentration that inhibit parathyroid hormone secretion. So these feedback loop uh, may control hormone secretion rate, the target tissue response, metabolic rate, electrolyte balance, etc., synthesis and storage via gene level regulation, and loss of feedback can lead to endocrine disorders. For example, Graves' disease, when this T4 is released, T3, T4 are autonomously released, and there is loss of inhibition of this TSH, and then there is Cushing syndrome, in which the adrenocorticotropic hormone release producing tumor, they resist this cortisol feedback, and this feedback loop is used for diagnostic testing also. For example, the dexamethasone suppression test relies on feedback loop integrity. There are some conditions that are a few but critical exceptions to endocrine negative feedback. This is positive feedback, a self-amplifying cycle that temporarily drive a physiological event toward a climax, after which normal negative feedback resumes. So, to define this positive feedback, this is a hormone's biological action enhances its own secretion, and the effect of this positive feedback is that it amplifies the original stimulus that lead to a surge or explosive event, and its termination occurs as it typically is short-lived, and it is terminated by a built-in negative feedback loop. Its biological utility is that it drives irreversible or decisive events such as ovulation of childbirth. So here you can see that there is a stimulus, and it causes the endocrine organ to release plasma concentration, to increase the plasma concentration of the hormone that is producing the effect on the target tissue, and hormone action or condition is produced. Now, instead of decreasing the or inhibiting the endocrine gland, for example, the estrogen that is produced after the stimulus from the anterior pituitary under the luteinizing hormone, the estrogen is released, and this estrogen provides a positive feedback, so there is more estrogen is released, and appropriate concentration of the luteinizing hormones are attained. Then a negative feedback starts, and then the anterior pituitary stops forming the luteinizing hormone. Now, to enforce this concept of positive feedback, the classical example of this is luteinizing hormone surge before ovulation. So here the estrogen concentration from the maturing follicle rises, and this exerts positive feedback on anterior pituitary, and the LH surge is triggered. LH or luteinizing hormone stimulate further estrogen release from dominant follicle, and peak luteinizing hormone plus estrogen, they derive the process of ovulation, and after ovulation progesterone rises, and there is negative feedback resumes to suppress luteinizing hormone and follicle stimulating hormone. Other examples, physiologic examples of positive feedback are childbirth. During parturition, there is release of oxytocin that is responsible for the contraction of the uterine muscle, and this causes more release of the oxytocin, and that more release of oxytocin causes the stronger contraction until delivery. Another example is milk ejection reflex. In this, oxytocin is involved, where suckling releases oxytocin, and that is responsible for more milk ejection, and this reinforces suckling. The LH surge we have discussed already. The disruption of these positive feedback loop, especially the hypothalamic pituitary axis damage, can prevent ovulation or cause amenorrhea in reproductive age females. So the variation occur in hormone release. These variation can be seasonal. These can vary on the basis of a stage of the development and aging. There may be diurnal variation or daily variation in the hormone release, and uh, there can be changes during sleep. The changes in activity, many of these cyclical variation in the hormone secretion are due to changes in activity of neural pathways involved in controlling the hormone release. So this table is showing the overview of cyclical hormonal fluctuations. These hormonal fluctuations may be circadian or diurnal at, that occurs around the day, and examples are cortisol, growth hormone, TSH, and melatonin, and they align physiology with sleep-wake cycle. Then there is ultradian cycle type that involve the time scale for that is less than 24 hours, approximately 90 minutes. There is pulsatile secretion of gonadotropin releasing hormone, luteinizing hormone, and insulin, and it maintains receptor sensitivity and prevent desensitization. Then infradian cycle type that lasts for more than 24 hours, and examples are menstrual cycle hormones such as estrogen and luteinizing hormone, and they enable reproductive timing. Then seasonal or circannual annual cycles that occur monthly or yearly, and the examples are melatonin, gonadotropin in some species, and their significance is that they impact reproduction, metabolism, and hibernation in animal. The pulsatile pattern is tied to the hypothalamic gonadotropin release hormone and somatostatin cycle that reinforces the importance of sleep hygiene, especially in children and adolescents. The growth hormone is released markedly increased during early or slow wave sleep, while it is decreased in late sleep or rapid eye movement phase of the sleep. And in insomnia, this process is disrupted, so that will affect the growth metabolism as a result of decreased growth hormone. This process or this cyclical release of the hormone is governed by hypothalamic oscillators and suprachiasmatic nucleus of the hypothalamus that function as biological clock, and it is modulated by light dark cycle, sleep wake behavior, nutritional status, stress, and physical activity of the person. So this cyclical release of the hormone has got some clinical significance also, because if the diurnal cortisol rhythm is lost, it may result in Cushing syndrome. The jet lag or shift workers, their circadian hormonal rhythms is also disrupted. Delayed puberty and infertility is due to disrupted pulsatile gonadotropin releasing hormone, and depression and sadness is associated with altered melatonin and cortisol secretion. Thank you for watching this video. If you have any query, please write in the comment box.